Hi, I'm Diana. Today's topic is CPR for an adult. When you are to perform CPR on an adult, you want to make sure that they are on a flat, firm, hard surface. When we are doing compressions, we also have to make sure we find the center of the chest. You can find the nipple line, center of the chest, or follow the armpit line to the center of the chest. Nipple line, center of the chest. When you are performing compressions, you have to make sure you use the heel of one hand, your dominant hand. When we interlace our other hand to make sure we have a good grip and we are able to do our compressions correctly. Nipple line, center of the chest, heel of one hand, interlace our fingers. When we do our compressions, we have to make sure we are over the body. Our weight's the one that's going to help us achieve the 2-inch depth. When we do our compressions, we also have to allow for chest recoil. That means that our chest comes back to its natural position. Remember, you have to stay at the rate of 100 to 120 beats per minute and achieve that 2-inch depth.